Your feet might be revealing secrets about your health right now, not next year, not someday in the future. Right now, that numbness you occasionally feel. The swelling that appears by the end of the day, or the strange color slowly appearing in your toenails. What if those aren't random? What if they are early warning signals your body is desperately trying to send? Here's something most people don't realize. Many serious health problems don't begin with dramatic pain or sudden collapse. They begin quietly, subtly, often in places we rarely pay attention to. And surprisingly, the feet are one of the first places the body shows signs that something deeper may be wrong. Circulation problems, nerve damage, metabolic disorders, even stress on vital organs. The real question is this: are you paying attention to what your feet are trying to tell you? Today, we're going to walk through several foot changes that may look harmless, but can actually reveal deeper health issues. Some of these signs are easy to miss, but once you know what to look for, they become impossible to ignore. Sign 1. Constantly cold feet. Most people dismiss cold feet. Maybe the air conditioning is strong. Maybe it's winter. Maybe you just run cold. But what if your feet feel cold even when the room is warm? What if thick socks don't seem to help? Your feet are the farthest point from your heart, which means they depend heavily on strong circulation. Think of your blood vessels like a highway system. When traffic flows smoothly, everything works fine. But when there's a blockage or slowdown, the furthest exits feel it first, and your toes are that final exit. Poor circulation can sometimes signal peripheral artery disease, early cardiovascular strain, metabolic imbalance. Now ask yourself something. Do your toes ever turn pale or slightly bluish? Do they take longer than the rest of your body to warm up? Do you feel tingling along with the cold sensation? Many people notice these symptoms years before they are diagnosed with heart or vascular problems, because the body whispers long before it screams. There's another factor many people overlook: stress. Chronic stress causes blood vessels to tighten and constrict. Over time, this affects circulation patterns throughout the body, especially in the feet. Try this quick check. Press gently on the tip of your big toe until the skin turns pale. Then release. Does the color return quickly, or does it linger longer than expected? That tiny delay might reveal how efficiently blood is moving through your body. Your feet might not just be cold. They may be asking for better circulation, more movement, and better care. Sign 2. Tingling or numbness. Have you ever felt a strange buzzing sensation in your feet? A mild pins and needles feeling? Almost like a small electric current moving under the skin. At first, it's easy to ignore. Maybe you crossed your legs too long. Maybe you slept in an awkward position. But when numbness or tingling becomes frequent, it may signal something deeper. Your feet contain thousands of nerve endings. They're incredibly sensitive. When those nerves stop communicating clearly with your brain, it rarely happens without a reason. One of the most common causes? Blood sugar imbalance. Long before someone receives a diabetes diagnosis, the small nerves in the feet often begin to show stress. Another possible cause is vitamin B12 deficiency. Vitamin B12 helps maintain the protective coating around nerves. Without enough of it, nerve signals become distorted. That's when tingling and numbness begin. Think about this for a moment. Do you ever feel numbness at night? Do your feet feel unusually thick, almost like you're walking on padding? Have you stumbled slightly without knowing why? These subtle changes can be early signs of nerve dysfunction. And here's the important part. Nerve damage is much easier to prevent than to reverse. Your feet may be whispering that your nerves need support. The question is, are you listening? Sign 3. Persistent swelling. After a long day, mild swelling can feel normal. You stood too long, you walked too much. Gravity did its job, but persistent swelling tells a different story. If your socks leave deep marks in your skin, if pressing your finger into your ankle leaves a dent that stays for several seconds, that's called pitting edema, and it's not just about fatigue. Swelling occurs when fluid builds up in the tissues. Your body carefully regulates fluid through 3 major systems: the heart, the kidneys, the lymphatic system. When one of those systems struggles, the feet often show the first signs. Persistent swelling can sometimes indicate heart strain, and when the heart cannot pump blood efficiently; kidney dysfunction, when the body struggles to regulate fluid and sodium; or even liver problems, which affect proteins that keep fluid inside blood vessels. Ask yourself, is the swelling worse at night? Does it affect both feet equally? Do you sometimes feel short of breath along with it? Swelling isn't just a cosmetic issue. It can be your body signaling that fluid balance is under stress. Sign 4. Changes in your toenails. Your toenails grow slowly and quietly. Most people barely notice them. But when they change, they can reveal a lot about what's happening inside your body. Have your nails become thicker than before, yellowish in color, brittle or crumbly? Sometimes this is simply a fungal infection. But persistent nail changes may also reflect circulation problems. Poor blood flow limits oxygen and nutrients reaching the nail bed. That affects how nails grow and appear. Slow-growing pale nails can sometimes suggest anemia. Spoon-shaped nails may point toward iron deficiency. And severe nail curvature, known as clubbing, can sometimes be linked to chronic heart or lung conditions. Your nails may seem like a small detail, but the body often sends its earliest signals through tiny changes like these. Sign 5. Unexplained foot pain. Foot pain after a long hike makes sense. Foot pain after new shoes makes sense. But pain without a clear cause is different. A burning sensation in the sole. A sharp pain in the heel. A deep ache in the arch. These symptoms can signal inflammation inside the body. One possible cause is gout, where uric acid crystals build up in joints, often starting in the big toe. Another is arthritis, which frequently begins in the small joints of the feet. Sometimes unexplained pain relates to circulation problems or nerve damage. Poor blood flow deprives tissues of oxygen. Damaged nerves can send pain signals even when no injury exists. If the pain appears suddenly, worsens at night, or affects both feet symmetrically, your body may be signaling something deeper. Pain without injury is rarely random. It's information. Sign 6. Changes in the skin. Take a moment and really look at the skin on your feet. Not casually, carefully. Is it extremely dry even when you moisturize? Are there cracks in your heels that never fully heal? Does the skin appear thin, shiny, or tight? Skin changes often reveal circulation or metabolic issues. Poor blood flow can cause skin to appear glossy or pale. Hair growth on the toes may decrease. Small wounds may heal slower than before. Persistent dryness can sometimes relate to thyroid imbalance, which slows metabolism and reduces oil production in the skin. Recurrent fungal infections may indicate elevated blood sugar, immune system stress. The skin on your feet constantly reflects internal balance. When that balance shifts, the skin often shows it first. Closing story. Message: your feet do much more than carry your body. They carry information. Signals. Warnings. And sometimes those warnings appear long before serious disease develops. Coldness, tingling, swelling, nail changes, unexplained pain, skin changes. Individually, they may seem small, but together they can form a picture your body is trying to show you. The body rarely fails without giving clues. It speaks through symptoms. The real question is whether we choose to listen. So tonight, take a moment. Look at your feet. Notice what they may be telling you, because sometimes the quietest signals are the ones that matter most.